So I'd say that I think the reasons that people consider genetic testing are multifold. The first reason to identify the genetic cause of an epilepsy is that in many cases it could change treatment. The likelihood of that happening in an adult patient with epilepsy is not high right now, but there are certain cases where genetic testing can definitely change either the existing drugs that we use or point towards new drugs that we should be using for the epilepsy. And also knowing identifying the cause of the epilepsy, it can help us further research that can develop new treatments. And there's a lot of gene-directed treatment going on right now, but not immediately available. But so knowing that I think can be really important. So, and this is a field called precision medicine, where we're really trying to identify the cause of a patient's epilepsy and then target it with the appropriate treatments. But I think in my population, there's a lot of other reasons to consider genetic testing with epilepsy. One reason is just to know. A lot of these patients have had epilepsy their whole life, or they have a new diagnosis of epilepsy, and they want to know, why. So to have an answer rather than, well, you're just going to have to deal with this, often can be very meaningful. And also when you have a genetic reason for your epilepsy, you have a name, you can actually connect with other family members or other patients who have the same condition that you do on a genetic basis. And that can be very meaningful. A lot of support groups and foundations have really arisen and are driving research into conditions based on families and patients getting together who have similar genetic conditions, right? The third reason is also for education and family planning. So I started as a women's epileptologist and trying to give answers to my patients about pregnancy, and I was surprised how often the question came up of how likely am I going to be able to how likely am I to pass this on to my children? So that was a question that really drove me to start looking in certain cases for the potential causes. This is not always clean. Sometimes we can give people a very clear answer about that, and sometimes, given the state of the research, we have to give somewhat of an unspecified answer, but it's better than just saying we don't know.